Hi, this is Dr. Dumestri. So I thought that this comment was a great one about fat grafting, what it is, what is the overall safety, and just go into a little bit more info about that. So I talk about fat transfer to the breast all the time. I use it for my reconstructive patients. I use it for my cosmetic patients. I use it in the setting of implants. I use it in the setting of lifts, and it has different purposes. So what is it? Fat transfer is basically harvesting liquid fat through liposuction. So liposuction, tiny little access incision, long metal cannula, and then under suction it selectively removes liquid fat. Now normally that liquid fat is just discarded in the case of pure liposuction, but in the case of fat transfer we will clean it, process it, and then repurpose it to inject it into either your skin envelope, your underlying fat, or into the actual breast gland. Now, this liquid fat is a dead substance. So all tissue, whether it be fat, skin, muscle, whatever it may be, to survive in your body needs blood flow. So this is actually injected as a graft, meaning it's a dead substance when it's injected, and then it relies on your body actually growing around it to absorb and receive that fat. Now, fat grafting is absolutely safe. Like everything in plastic surgery, there is a right way and a wrong way to do it. So when you hear about complications with fat transfer to the breast, usually it is a quantity problem. So there's only so much fat that you can put in at one time into a certain area without causing issues such as liquid fat cysts, infection, or just areas that turn pretty firm and nodular. So basically when you're putting that fat in, you do tons of small little tunnels so they're each surrounded by healthy tissue incorporating that fat. Now, I'm not a huge fan of breast augment through fat transfer. It can certainly be done, but if that is the case, I like to take a very slow approach, meaning each time you're getting maybe a little half cup increase in size, and then each time you're stacking that fat on top of it. Fat grafting is what's done in a Brazilian butt lift. The BBL is where that liquid fat from the liposuction is re-injected all over the buttock area to give a larger volume. And that's the same situation in the breast. The most common scenario that I'm doing fat transfer is for contour enhancement rather than volume enhancement. So usually it's just to fluff or provide contour where needed. For example, if I'm doing breast implants and that patient naturally has a wide cleavage line, so the implants are naturally going to sit a little bit wider apart, fat transfer can be a great option to just provide a little bit of 1 centimeter thickening on each side, fluff and narrow those cleavage lines. For my breast reconstruction patients, often the mastectomy goes a lot higher than where the implant is sitting, so there's hollow areas. Again, that's where just even adding a centimeter or so of thickness can make a big difference for the overall aesthetic. Of the fats that's injected, we know that not all of it sticks. It's about 50 to 70% of the fat that's injected will stay permanently, and the remainder will resorb over the first 6 months to a year. By about a year, the fat that you have there is permanent, it's permanently part of you, it's alive, it's living, and it behaves the way the rest of your tissue does. So to summarize, fat grafting is absolutely safe. Some of the fat that's injected does resorb. That's an expected it's an expected effect. And yes, there are absolutely complications with fat transfer that usually refer to or are due to the amount of fat that's injected at one sitting. Hope that helps. Have a great day.